Okay, our next topic is gastric analysis. Okay, so what do you mean by gastric analysis? So gastric analysis is nothing else but it is a test. Okay, so analysis means what? Finding out. Okay, so what is the simple meaning of analysis? Finding out. So what they are going to finding out means whatever the contents in the stomach is there. So for example, now acid base. Okay, so acids are there. So minimal acid output is there. So that they are going to calculate is called as a gastric analysis. Okay, for example, in some gastric infections or the peptic ulcers or gastric irritations or whatever they are doing that, so they are going to perform and how much of acid levels HCl is going to be produced by the body surface, that they are going to identify of any tumors are there, so how much it is responsible, so everything they are going to calculate by the gastric analysis. Okay, so gastric analysis consisting of, it is a series of tests used to analyze the content of the stomach. So what they are going to calculate? Okay, so what they are going to do here means, so collecting residual gastric fluid from a fasting patient. So what they are doing, from the fasting patient only they are collecting the gastric secretions. So how they are going to collect these secretions means, for every 15 minutes for 4 hours, for example, so within 4 hours, and in these 4 hours and 15 minutes once and 15 minutes once, 15 minutes once, and they are going to calculate the gastric analysis. Okay, and after that they are going to introduce the intramuscular administration of the drug they are going to introduce. So what this drug they are going to give, what is the functioning of the drug, or the what is the action of this drug means, and it will helpful to stimulate our gastric output. Okay, so the HCl output it will be releases. Okay, or on this procedure we can do collecting stomach secretions every 15 minutes for 90 minutes. So here, so in the fasting how we can get, and 4 hours 15 minutes. Okay, and by administration of the drug in the fasting only, so what you have to do, and you have to after if you are administering of the drug, okay, so that drug is called as a, so I'll be showing a later thing what is the drug useful in the procedure. And after giving of the drug, how many minutes? 90 minutes and 15 minutes you have to give. In 90 minutes of time, every 15 minutes, and you have to do the gastric analysis of suctioning. Okay, and what they are going to take out in the suctioning here means, so you have to take the appearance of blood, you have can take bile or pH, volume, and millimoles of hydrogen ions per liter, and millimoles of hydrogen per volumes, and millimoles of hydrogen per hour of the specimen. You have to evaluate. These are the contents only we are going to taken from the gastric secretions or gastric analysis. Okay, so that is a definition or information regarding of gastric analysis. And what is the purpose of gastric analysis? Okay, so what is the purpose of gastric analysis here means, and in order to identify the stomach acidity, so how much level it is going to be takes, and what is the appearance, and what is the volume of the stomach's gastric secretions. Okay, and if the patient is having of gastric pains or the loss of appetite or the weight loss, and to identify what is the disorder which makes the person to be the these kind of process. Okay, and to suspect or to identify the peptic ulcers and gastritis and the, so Zollinger-Ellison syndrome. Okay, so the Zollinger-Ellison syndrome is also called as a the peptic ulcers. Okay, so the peptic ulcers and inflammation of the gastric areas, rupturing of the gastric areas is called as a syndrome of Zollinger-Ellison syndrome. Okay, so these are the signs and symptoms of the peptic ulcers or the gastric irrigations or the gastric secretions will be there in the Zollinger-Ellison syndrome. Okay, so and in order to find out some of the, so disorders like duodenal ulcers, pernicious anemia, and the gastric cancers, and to identify these they are going to do the gastric analysis. Okay, and what are the precautions you have to take care of this here means, and so whenever you are incubating of gastric incubation, okay, in gastric lavage, and how you are doing the procedure, in the same way you have to incubate the tube. Okay, so NG tube will be incubating, right? So in the same way you have to incubate the process. Okay, after that, so you have to take care while incubating the mouth and the nasal passage, whatever you are doing, and what are the problems you are occurring here means, and you may see some of the cardiac problems on the hemorrhagic and congestive heart failure. Okay, and severe gastric hemorrhage is also one of the complications for the precautions, because same precautions whatever the for a gastric lavage is there, and same precautions you can give in the this one. Okay, and so I have explained you what is a drug will be given for the procedure, right? And in order to stimulate the gastric acid output, that is pentagastrin. Okay, so that is also is going to be helpful. Major precautions you have to take if the patient who are having of the heart failures and severe hemorrhagic. Okay, and what is the description they are given? The simple description, nothing else but yes. So description means what? Regarding of what is gastric analysis. So gastric analysis nothing else but whatever the gastric acid secretions, to remove the gastric acid secretions, and they are going to be incubated the gastric GI, NG tube, nasogastric intubated through the mouth or the nasal passage, they are going to incubated. Okay, so after that whatever the basal gastric acid secretion. So first I have already in the definition explained you first what they are doing for the in the fasting 12 hours for 15 minutes. Okay, so for 4 hours of time, within 15 minutes they are going to do the performance, or 90 minutes they are going to do the performance. Okay, so here also the same way that how they are doing here means, so the patient should be fasting overnight before the incubation, and how much time, and 15 minutes for the patient to presence of the tube, and with the patient in sitting position we have to perform the procedure. And the first two specimens are examined, visible of the blood and volume, but discarded. Why? Because and the patient with the tension, so what is going to be there means excess of gastric secretions, that is not limited, so that you have to remove it out. Okay, and the later test you have to take it out. Okay, the patient is allowed no liquids during the test, and saliva must be injected into the stomach. So after the everything has to be removed from the stomach, so what they are going to do, so already I explained how many samples, 4 samples they are going to take for the so basal acid output. Okay, basal acid output nothing else but whatever the acid from the stomach we are taking, so that is acid called as basal acid output. So after that, so these basal acid output, and you have to so mingle with the normal sodium hydroxide, 0.1 ml of a normal sodium hydroxide you have to make in order to make out the concentration pH of how much, 3.5, so that you have to calculate. Okay, so that is a basal gastric secretion you have to do. Okay, so one more I am explaining. Once again I am explaining to you. So the basal gastric acid secretion is nothing else but the patient should be fasting for 12 hours. Okay, so after 12 hours, and you have to make the patient after incubating of the NG tube, nasogastric tube, into the either from the mouth or the nose, and you have to make sure the patient should be stable for how many minutes, 10 to 15 minutes. And after that we have to give the patient as a sitting position, you have to give to the patient, and the procedure means evacuating of the specimen from the gastric substances for 90 minutes. Okay, how many times? For 15 minutes. 15 minutes separately you have to take the 4 samples you have to take. Okay, so that 4 samples what you have to, is called as a basal acid output sample, and that sample you have to add a concentration of sodium hydroxide, you have to add it to that, and in order to make out the pH concentration of 3.5. Okay, so that you have to add that. Okay, so next one is so already I have explained what are the contraindications. Okay, so alcohol and because hydrochloric acid which is present, which is absent, so you can't able to remove the HCl. So what will happen? So automatically the rupturing of the area is going to be scenes here. Okay, the gastric glands in the stomach is not going to be produce the HCl, so automatically that disorder is one. And incubation during the initiation of the tube is one of the pernicious anemia. And next one is some terms are explaining, already I explained you this, and Zollinger-Ellison syndrome. So for example, already explained you that stomach, duodenal and upper small intestines, or the tumors, or maybe the peptic ulcers, so these are all the inflammation goes to the Zollinger-Ellison syndrome. Okay, and whenever, so you are not going to be perform, and even if the hydrogen concentration they are not able to confirm with these, and next procedure they are going to do is a gastric acid stimulation test. Okay, so first just they are simply by basal gastric acid secretion only they are going to do, by injection of NG tube they are going to do. So here by injection of NG tube only, so what they are doing here means, yes, and same procedure, so they are going to gastric acid stimulation test. Okay, so in the word itself they are explaining. So gastric acid stimulation, so in the stomach itself they are stimulating the gastric. So how they are stimulating, already explained it, the one drug that is essential for stimulation of the gastric. What is that? Pentagastrin. So whenever intravenously you have to give this. Okay, see here. Okay, so is injected subcutaneously, you have to inject to the patient, and after that, and these injection will help you to stimulate the process. Okay, how much hour you have to do this means 15 minutes for 1 hour you have to go for the procedure. Okay, that procedure is called as what? Post stimulation specimen. Okay, and this post stimulation specimen, that you are going the same precautions, and they should not give any fluids to the patient, and avoid giving of fluids, and the saliva is mandatory to swallow. Okay, and next, and what are the two values they are going to identify, that is maximal acid output they are going to identify, and whereas in a peak acid output, it is also called as a basal acid output. So these outputs they are going to categorized according to the normal level of the process. Okay, and see here, and what is analysis calculation they are going to see here by doing of a test. Okay, and what are the test normal values is the. Okay, so I will show you afterwards. I'll show you the normal values, and what is the preparation you have to make to the patient means, already I given the precautions that 12 hours of fasting is compulsory, mandatory, and whenever you are doing this pentagastrin administration of the procedure, and advise that for 2 to 3 days, and they should avoid these type of antacid, anticholinergics, cholinergics, alcohol. So these drugs they have to stop to take. Okay, and ask the patient to be free from the psychological stress also, and whereas the food whatever they are taking, that should be so less gastric irritables. Okay, and aftercare what you have to take means, and whenever the NG tube you are incubating to your nasal or the mouth, so you may see that there is a rupturing over the throat walls, the sore throat will be there, and you may see nausea, vomiting, and abdominal distension and pain you will see, and following of removal of the gastric tube. And if the patient is having sore throat, and soothing and the lozenge may be given. So what they are saying, that if any irritation is there over the throat, and to soften the throat, and they are giving some of the liquidites. Okay, some medications also you can give, and if the patient is still more irritated. And what are the complications they are going to give here means, yes, only two complications they are mostly the blood pressure and due to anxiety levels. Okay, the patient is very due to anxiety, so blood pressure will be increases, that is the main cause, and other complications includes bleeding and heart dysarrhythmias, and esophageal perforation will be there. Esophageal perforation means rupturing of the esophageal valves. Okay, and the laryngospasms means, so the valves of the larynx is going to be ruptured. Okay, and decreased partial oxygen, your blood oxygen levels is going to be decreases. Okay, and already explained you the results. Okay, already what is a fast, if the patient is fasting volume, the normal value is how much? 20 to 100 ml, and fasting pH, if you are adding pH to the substance, is less than 2.0. And next one is a basal acid. Okay, so the already I have shown you in your procedure. See here, yes, gastric, yes, maximal acid output and the basal acid output. Okay, that normal values only we are going to do the test here. So what is a normal value? Whenever you are in a fasting value, 20 to 100 ml, and whenever fasting pH, so what we are taking, sodium hydroperoxide we are taking, so that is how much? 2.0, it should be less than, then only it is normal. And basal acid output for men, how much? 0 to 5 millimoles per hour, and basal acid output for women, and 0 to 4 millimoles per liter, and maximal acid output for men 5 to 26 millimoles per liter, and whereas an maximal acid output for women 7 to 15 millimoles per liter. Okay, so by this consideration, and if these normal values are exaggerated, means increased more than this, and you can detect out that, and there is a marked result of suggestive and Zollinger-Ellson's syndrome. So here Zollinger-Ellson syndrome, in a key term already we have discussed that. Yes, okay, aclardia. So aclardia nothing else but what is here, and the no production of gastric acid is there, so that is a disorder we can suggest. And duodenal ulcers and cancers, everything we can able to suspect with this if any below or normal above levels of the condition. Okay, and what is a healthcare team rules? Okay, so what is the rules you have to identify here means, and whatever the physician he is performing the gastric analysis, so he has to interpret with the results. Okay, and the test physician must be accurate, the patient history is very very important, and also and the drugs, the previous drugs what he is having and previous illnesses, because before the consequences anticholinergics, antacids, they should be stopped. Okay, so that you have to taken care before the procedures. And degree of patient condition also you have to performed, and clinical laboratory scientists or medical technologies also is very very essential to identify and what is the normal to abnormal value of the condition. So that is the process or the procedure or the nursing role what the healthcare team has to be taken care. So that is regarding of the gastric analysis. Okay, so just I will revise what is the gastric analysis. Yes, gastric analysis means what? Gastric analysis consisting of, it is a test that is going to be performed, and in order to remove the contents of the stomach to find out which type of disorders. Okay, and how they are going to do the disorders, and four types we have discussed, and what is the purpose, what are the precautions to be taken, and description. Okay, and in which way you have to introduce the NG tube, that is only. And two procedures, what basal gastric acid secretion procedure 1, and also gastric acid stimulation test. Okay, they are going to do the analysis of that one, and what is the preparation they are going to make, and aftercare, and what are the complications of the procedure and the results of the procedure. Okay, and what is the healthcare team roles. Okay, so this is